Hello, my name is Karl Kodweis, and I am an assistant professor in the College of Pharmacy, where I direct two first-year courses, one of which helps students transition to the pharmacy curriculum, and the other is a community pharmacy-based skills lab. And today, my teaching tip that I want to talk about is trying to find ways to integrate AI literacy into your teaching wherever you can find where it fits. I'd like to take you back to a time a few years back when the phone that you had in your pocket resembled a flip phone that could do barely more than make phone calls and text messages. However, as decades have progressed, you now have a supercomputer that can do a multitude of applications and items that you previously may not have even thought was possible in that realm. And so I liken that analogy to what we're currently seeing in AI and the development of these technologies. With the recent advent of chatbots and generative AI, we've seen kind of an explosion of these technologies being implemented throughout the healthcare system and throughout the healthcare landscape. And therefore, by telling our students or teaching our students how to use these, we are effectively graduating healthcare providers that are adept and literate within these programs, as opposed to either ones that don't understand the backgrounds and the limitations, such as hallucinations, bias, or just blatantly accepting the AI outputs as answers that are clinically appropriate for the situation. And so in that context, I believe that it's no longer a question of burying our heads in the sand and figuring out whether or not this technology is here to stay. It's more of how do we effectively engage with these and how do we get our students to do so as well. So the way that we can teach our students about how to engage with these platforms and technologies is through a topic and concept known as AI literacy. As a concept, basically encapsulates all of the worries that we currently hear about these devices and proposes a toolkit of how we can then use them to teach students about the limitations and benefits of these platforms. To showcase how we have integrated principles related to AI literacy into our own educational endeavors, the first-year pharmacy students take a drug information course in the second semester of their first year, where they engage with a drug information question that typically doesn't have a yes-no answer or an answer that is easily retrievable through many databases. And so they work within their groups to develop clinical questions and investigate answers that they then present to a provider to give them a well-rounded answer that is evidence-based in primary literature. So in our project this year, we decided to add a third component which focused on AI literacy. Students began going through an active learning exercise and a lecture based on principles surrounding AI, focused on ethical and responsible use of the software, and then also went over concepts related to hallucinations and prompt engineering so that we could effectively teach them some of the limitations related to the software. Then what we asked them to do was to take their item that they had already answered, their question from their project, and developed an engineered prompt, ask the chatbot, and then to evaluate what the chatbot created so that they were able to see, based on this assignment that I already completed, how does this chatbot do with answering that same question if I propose it in a well-structured, evidence-based way? From this exercise, students were able to accurately and adeptly identify points of ethical bias or bias that was unintended by the bot but was just kind of baked into the software itself. But they were also able to identify citations that it was referencing as fact, just completely made up because it didn't have a proper answer to it, and so it generated something from scratch. And so by allowing them to look at this output on an assignment that they've already done and created, it was interesting to kind of see that they were identifying these things that we had talked about days prior, if not, right beforehand, where they were able to apply those concepts, figure out, okay, so there are things that it's biased on, things ethically that I don't trust 100%, and things that I need to look at before I send anything out that was AI assisted or AI generated. And so getting to that level of the educational process, they were evaluating and critiquing, not just applying it to a situation. And so in that case, I feel like you get a much more well-rounded educational experience. You can hit higher levels of learning with it by asking them to then engage with the outputs from a critical perspective. So you're probably asking yourself, why or how can I do this myself? And so I have a few tips if you're interested in starting this journey. And the first one is just to get educated and knowledgeable on this concept and this topic of AI literacy, where you can understand and engage with these platforms from a critical, well-rounded knowledge base on the platforms, as opposed to just demonizing them outright as a tool not to use. I would recommend engaging with the platforms themselves so that you understand at least the limitations and the benefits of them. Secondly, I wouldn't completely do a curricular overhaul of your program, but try to find assignments or items that are already in place within your curriculum that you're able to augment with an AI evaluation exercise, whether it be a SOAP note writing or a health literacy based assignment where you're able to have the students engage with outputs from these chatbots and hit a point where they're evaluating an output, which is a higher level of learning that we want to go for within these students. And so you don't have to reinvent the wheel and create a brand new assignment, but you can implement it within your current existing assignments that you already use. And then third is if you want students to use it, make sure that that is clearly articulated and transparent within either the assignment criteria or at the very least within your syllabi, because having that level of transparency and saying, here's how you can use AI, here's how I don't want you to use AI, can put those hard, dead rules or guardrails in place for students to then follow so that we are still able to meet those outcomes related to. So in closing, this technology that we're talking about today is already here. We are currently seeing it implemented throughout all other aspects of our society. And so now it's time to move from the flip phone basics into the smartphone fluency, where we are kind of exploring what are the applications and opportunities that this software and platforms are able to achieve within our day-to-day now. And so by teaching our students how to engage with these platforms appropriately, ethically, and responsibly, we can then usher in a curiosity for these students to adopt and to kind of look at what are some ways that us as healthcare providers in the future can leverage these technologies for the health of our patients and to kind of make the healthcare system work much better for everyone. Thank you for listening.